Doctors Without Borders is worried about what it calls a worsening measles epidemic in the Democratic Republic of Congo. The body says the epidemic has actually worsened since July, with the rise in new cases reported in several provinces. Quoting government sources, the body said it is fighting the measles epidemic in 13 DRC provinces alongside local teams from the Congolese Ministry of Health. The measles epidemic has been reported in 23 out of 26 provinces in the country. Measles is a highly contagious viral disease for which no treatment exists. The only way to fight it is vaccination and treatment of the symptoms in the hope that the patient will be strong enough to naturally fight off the infection. The measles epidemic, declared in the Democratic Republic of Congo on the 10th of June, is the deadliest the country has experienced since 2011 to 2012. Between January and early August 2019, over 145,000 people have been infected and more than 2,700 have died. Since July, the epidemic has worsened, with a rise in new cases reported in several provinces. Only $2.5 million has been raised out of the $8.9 million required for the health cluster response plan, in stark contrast with the Ebola epidemic in the east of the country, which attracts multiple organizations and hundreds of millions of US dollars in funding. Now, for more on the measles crisis in the Democratic Republic of Congo, we are joined in studio by Monica Genya, Doctors Without Borders Association Manager. Monica, good evening, and thank you so much for joining us on The Globe.
Thank you for having me.
Now, these are very stark and scary figures, scary numbers. How serious is this outbreak, and how many people affected so far?
Like we were saying, that it is the most serious that we've seen in the last 7 years. Since 2012, we haven't seen anything more serious than this. So we have witnessed 145,000 people infected. That's a staggering amount. We've managed to vaccinate over 400,000 children between the age of 6 months to 5 years. And we have been having at least 27,000 people in our treatment facilities in 13 provinces who we've managed to help.
Now, the epidemic is reported to be in 23 provinces out of 26. This is literally the whole country.
It is, and it's a large country, so the spread is quite wide. It's very serious. It's getting worse. It is getting out of control. Bad infrastructure, the conflict in the country, Ebola in the east of the country. It's challenging, and the situation is getting out of control.
But why are we seeing such high numbers of measles, especially in a country like the Democratic Republic of Congo? Is it maybe the way the country is set up, or has it just been delayed action from government in dealing and handling vaccinations in the country in terms of the health side of things?
It's a highly contagious disease, and there's been a malfunctioning health service in the country for many years. Doctors Without Borders has been in the DRC since 1977, a very long time, and we've seen the situation getting worse with health services. So not everybody who should be vaccinated has been vaccinated, and Doctors Without Borders is trying our best to get as big coverage, as wide a coverage as we can.
Now, since measles being declared an epidemic in the country, what's really needed to take place? I see that reports of you only have $2.5 million where there's a requirement of about 8.9 plus.
Yes.
Where exactly is the that gap when you look at the response to the Ebola outbreak and the figures that the funding they seem to be getting?
Yes, we're working with partners, other humanitarian actors, but what we've seen is that there are not enough humanitarian actors on the ground. So we're calling for more humanitarian actors to come on the ground, assess the situation, mobilize funding, and join us in our efforts. Unfortunately, it's definitely not a competition, but the state of measles in the country has been eclipsed by the response, and it's a good response towards fighting Ebola, but this is just as serious and should be taken just as seriously.
Why are they not taking it so seriously? Is it one of those viral diseases that haven't really made much of an impact in terms of knowledge and people understanding what it is? Or is it the fact that the reaction or the turnaround time with regards to Ebola is a lot quicker?
I think that people may have gotten used to the idea of measles. It comes around every few years and they've heard of it before. Ebola might be a bit more scary, but not more deadly, as we have seen from the figures. So what we're saying is, let's shine a spotlight on it. Let's show that it's there, it's getting worse, and ask for people's support in our fight against it.
Let's talk about the work and the role that Doctors Without Borders plays in the DRC. As you say, you've been there since the 70s, literally, and we're talking now 2019. Talk about the work that you do on the ground and, you know, the impact that is made by Doctors Without Borders, and looking at the measles epidemic, the work that you do with regards to, you know, the Department of Health of the DRC. How well do you work together, and the reaction from government with regards to measles? Are they playing their role and their part in dealing and facing with this challenge?
Yes, so Doctors Without Borders works hand in hand with the Ministry of Health, who have been playing their part as best as they can. Like I said, the infrastructure is not good at all. The conflict in the country, the ongoing internal conflict, has made it difficult to reach very remote areas. Just the same challenges they're facing are the challenges we're seeing every day. We work with several other humanitarian actors as well. We're all facing the same challenges. Measles has been present in the country before and has been fought off successfully, and fortunately in very remote areas it can break out in these pockets. MSF is present in 13 provinces, and recently we've had mobile teams in a province called Maindombe, where we have light mobile teams that go deep into the remotest areas of the country in order to find people and vaccinate them.
Do people understand, people on the ground, the Congolese people, understand what measles is and the fact that it is quite deadly?
A lot of them do, some of them do not, and health promotion is very important in this case, earning the trust of the community. Like we said, we've been around since the 70s, so they do know us and for the most part do trust us. Apart from vaccination and combating measles, we provide primary health care. We take care of pregnant mothers, etc. So the trust is there, and we build on it as much as we can.
Now, the conflict on the ground, as Doctors Without Borders, humanitarians, and you must get caught up in the conflict. And you know, we've seen in recent times where humanitarians are either abducted or unfortunately lose their lives because they get caught up in the crossfire. How has it been on the ground?
It has been extremely challenging. We try to make it as clear as possible. As humanitarians, we are neutral, we are independent, we are not there to take any sides in the conflict, and our only role is to bring medical aid to people who need it, and that helps a lot. But as you say, it can be very challenging for all humanitarian actors in this kind of situation.
Let's speak about the responsibility for fighting such an epidemic in the DRC. It's as you say, it disappears and then it's back in whether 3 years time, and people understand what measles is, and the only way to fight it is if a person is vaccinated and if they have a strong enough immune system.
Yes.
You know, whose role is it? Who's supposed to face this epidemic and ensure that you know, countries like the DRC are you know, vaccination is done and there's understanding, and you know, measles is not such a crisis.
Yes, it's a public health emergency, and definitely the Ministry of Health, but ministries of health around the world, because it's such a small world these days that we cannot say, you know, something that affects people in DRC is not going to affect people elsewhere. So it's everybody's concern, and everybody should be very concerned when an outbreak such as this one cannot be contained.
Regionally speaking, and the positioning of the DRC, is it only contained within the DRC borders, or are neighboring countries also, should they be worried with, in terms of infections or cross-border infection, when people, migrate or leave the country or cross into different borders?
At the moment, we are seeing it in DRC, so we are basically combating it within the borders of DRC, and we hope to have it contained within those borders, and to make sure that it gets eradicated as soon as possible, so that it doesn't spread.
Now, we touched on early on in our discussion, we touched on the fact that there's also this Ebola epidemic, which has seen, thousands sort of losing their lives a number of years ago, and now the fight against Ebola has intensified. Reaction time is a lot faster than what it was a number of years ago, and we've seen about 900 people who have, recovered from Ebola, which is, we're told that it's amazing stuff, and in terms of the program or the so-called vaccination regime, or is it looking at Ebola and the impact of this outbreak? Has measles fallen sort of the wayside, and everyone is focusing on the Ebola outbreak and how people die so quickly, and the impact, and the fact that it's so quick with regards to the turnaround, and we don't even know the details of measles. How, once a person is infected, how quick is that turnaround? And are funders just sort of maybe caught up between, where do I send my money?
Yes, there is a lot of divided attention there, and that is a pity. Doctors Without Borders and other humanitarian actors are fighting, the good fight on all fronts. So there is Ebola, there is measles, there always will be malaria and other diseases as well. And what we have to do is we just have to keep focused on giving the best care that we can to everybody who needs it.
And the impact of all these outbreaks, it's Ebola on the one hand, it's measles on the other hand. What has this done for the Ministry of Health in the DRC?
They found it very challenging, and their resources are, I imagine, quite depleted. But they are working really, really hard, and we see them fighting every day. We're working alongside them, and they're doing a good job.
What message would you give out to, funders with regards to that shortfall that you're looking at? I mean, 2.5 out of 8.9 is a lot of money. It's a huge gap.
Yes,
how do you work around that and ensure that, money that is channeled to measles is, received quickly, and people understand, or funders understand, that just as big as the impact of Ebola is on the country and the region, measles, on the other hand, is also quite, impactful, and a lot of people lose their lives without the right amount of vaccinations and a recovery regime.
Yes. Doctors Without Borders depends on the support of our funders and of our partners in South Africa, in the rest of the world. And we've experienced a lot of support for them. And what we'd like to say to them is not to get tired of this support, not to experience the fatigue that they must be feeling. We know this. But to keep on supporting us the way that they have been, and to pay special attention to measles, which has unfortunately fallen a bit in the wayside, to put it back in the spotlight, and to think about how they can support us in this.
In terms of the work that you do, you're also involved with the Ebola outbreak. Measles is also a huge part of this, and you mentioned the fact that the people on the ground, the Congolese people, understand what measles is, but are they facing reality with regards to measles, and or are they more afraid of Ebola?
From what I've witnessed personally, everybody is more afraid of Ebola because of the stigma that's attached to Ebola. I wouldn't say, looking at the numbers, that it's more deadly than anything else, or more deadly than measles. And like we said, it's not a competition. But there is a lot of stigma attached to Ebola that might not be there in other diseases, which are just as deadly.
And the reception with regards to the community, the people on the ground, when it comes to measles and the vaccination process. We've seen reports on the news, on a daily basis, where young children and adults, pregnant women are vaccinated, and that whole process. The people on the ground, filtering through, as you said, some of the areas in those regions are very rural. And
Yes,
are you
right.
able to reach all those areas? And, with regards to, we touched on the issues of conflict, how do you work around that as humanitarians, and also being afraid for your own safety at the same time?
Yes. Doctors Without Borders never stops trying to reach people. So we have been to some of the most remote regions in the world, and I don't think that there's any spot that we would say we can't reach or we won't reach. We will keep trying until we get there. The communities have been very welcoming. Like we said, health promotion plays a big part in having them come to us when we can't get to them, so that they can get the life-saving vaccinations and medications that they need.
Donor fatigue is a huge problem. You speak about different epidemics, you speak about different crises all over the globe. How do you work around ensuring that donors do not forget about those little regions that go through major epidemics and crisis, and ensure that they're able to, spread their funding to all these different spaces or regions, ensuring that there is crisis is being attacked or taken care of from all angles?
We try as hard as possible to communicate the work that Doctors Without Borders does and has done in the past and is hoping to do in the future. And we've been able to rely on a very huge outpouring of support from donors around the world. Our funding is over 90% from individual donors, small donors who give what little that they can, but enough of them that can keep our projects running, and we're very grateful to them. And what we say to them over and over is, see the good that you've done, and please continue with this good work.
Let's speak about very quickly, just before we wrap up, in terms of the figures, what does it entail? Because sometimes you find that donors want to know the little details of what does it entail with regards to that vaccination, the cost implications, and how does it work? How quick are you able to get vaccinations to the DRC regions? I mean, 23 provinces out of 26. How quickly are you able to get those through to the communities? And, we were told at some point that some vaccinations take a long period of time to make.
This is true. Luckily for us, the measles vaccine is available, what is challenging is transporting it into a remote area, because it has to be kept between 2 and 8 degrees. And in the Congo, which is a tropical rainforest, it's quite hot. So transporting it with refrigeration, ice packs, etc., is a costly endeavor. Doctors Without Borders has a lot of experience in this, and we're able to send it wherever we need to get it. Like we said, the main thing is funding, being able to be funded well, so that we can respond as quickly as possible, and we respond quite quickly.
Monica, thank you so much for your time, and thank you for the good work that you do in all the different regions with all the crisis facing the world. That was Monica Genya, Doctors Without Borders Association manager, joining us live.